My name is Ashlyn, and welcome back to Medicated and Motivated. This episode is going to be a long one, so I do just want to jump right into it. My whole goal of this podcast is to show you the real and raw lifestyle of being an EMS provider, whether it's the good, the bad, or the ugly. This topic that I'm talking about today is the ugly. Today we're going to be talking about Elijah McClain. I wanted to mix the true crime format, where we talk about a case and what we've learned from it, mixed with EMS. And Elijah McClain was a 23-year-old male who died at the hands of police officers and paramedics. When I heard about this case initially, I thought it was just, a case out of Colorado. It involves ketamine and it involves paramedics. It is so much more than that. Today, my objectives are to share with you Elijah's case, who he was, what happened to him, and really where it all went wrong. We're also going to be discussing ketamine and the properties of it and how media really gave it a bad rap when it truly doesn't deserve it. Because as Prep Medic says on his YouTube video covering this case, ketamine does not kill patients. Bad paramedics do. If you like the format of this episode, please tell me. I would love to do more of this format, trying to find cases where we can learn from them as providers and really just intermingle true crime and EMS, because I am sure that Elijah's case is not the only one. And there are several more out there that don't have as much attention. So if you have any recommendations, please comment them down below. Let's get started. Elijah McClain was born on February 25th, 1996 in Denver, Colorado. He was described as an introvert but a very kind soul. And at the time of his death, he was actually a massage therapist and loved spending his lunch playing the violin at the shelter, for animals. And I think that really speaks volumes to just his character alone. And that is something that is really hard reading about this case, is it's never the bad people. It's always the amazing people that suffer at the lives of people that are supposed to be helping them. Other than that, there is not a whole lot to know about Elijah's life. His mom has kept a lot of things private for good causes, and she really just wants everyone to focus on the justice and that this happens to no one else. So let's dive right into what exactly happened on August 24th, 2019. Aurora PD received a 911 call for a suspicious male walking near a gas station. The caller stated that the male was waving his arms around, talking to himself, and just acting erratically. This male ended up being Elijah. Elijah was walking home from a gas station after buying tea for his cousin and was listening to music through his headphones that were connected to his phone that he was holding in one hand and had a bag in another. Elijah was wearing a long sleeve coat with a ski mask on, carrying a bag, like I said, from the gas station. Officer Nathan Woodyard is the first to arrive on scene around 10 p.m. I want to say it's 10:40 p.m. on the body cam footage. And Woodyard immediately starts yelling at Elijah to stop.
There. Hey, stop right there. Stop. 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 I have a right to stop you because you're being suspicious.
At no point in the body cam footage do any of the responders explain to Elijah what's going on. So initially, when Officer Woodyard stops Elijah, he's just screaming at him aggressively, right? He never introduces himself. Hey, my name is Officer Woodyard. I'm stopping today because there's a report of a suspicious male. We just wanted to check up on you and make sure that you're okay. None of that is ever said. And most of the time when a police officer stops an individual or pulls them over in their car, that is how you make the first impression. I talked to my boyfriend about this for a long time, who is fresh out of the academy and on his own as a street police officer or a patrol officer. And even he said that is something that they worked on extensively when he was in the academy, was how to approach people. Because you don't want to outright start escalating the situation aggressively. Like if you start yelling at someone, the situation is never going to be calm. The situation is already going to start on the wrong foot. But if you approach somebody with the right demeanor, the right tone, there may never be a problem in the first place. But that is the exact opposite of what all of these officers did. Not a single one of them, even responders like just fire, EMS, police, all of them, no one ever introduced themselves and no one ever explained to Elijah what's going on. Within 10 to 15 seconds of Officer Woodyard leaving his patrol car, he starts making physical contact with Elijah, grabbing him on his upper arms. Like he's trying to physically restrain him and turn him towards him, like gaining control of him. Body cam footage is showing Elijah actively struggling, and rightfully so. Like if an officer just came up to you and grabbed you, yelled at you to stop, like you'd be freaked out too, right? And Elijah was wearing headphones, so Officer Woodyard yelling at him, he may not have heard him in the first place. So now he's being grabbed and he's startled and he's scared. So all of his reactions in the body cam footage is very valid. He keeps asking Officer Woodyard, what's going on? I have boundaries. Please don't touch me. I'm trying to take my headphones out. What's going on? Like trying to figure out what's going on.
No, I want to leave me alone.
No, we're gonna talk to
you guys started to arrest me, and I was stopping my music to listen. Now let go of me.
Officer Rosenblatt is the second officer to arrive on scene and immediately starts helping Officer Woodyard try to gain control of Elijah. And when I say gain control, they are aggressively trying to gain control, because at this point, Officer Rosenblatt and Woodyard are trying to like pull Elijah over to a wall and like push him against it and restrain him. Again, no one is explaining or communicating with Elijah whatsoever about what's going on. Now a second officer is on scene, and a third officer, Officer Redema, is about to arrive on scene as well. Not a single person is telling Elijah what's going on. The use of force is insanely aggressive on Elijah, and it just continues to escalate throughout the entire call. At this point, when Officer Redema arrives on scene, which is very shortly after Rosenblatt, they are all three trying to wrestle him to the ground, and at some point, Officer Redema proclaims that he saw Elijah reaching for Rosenblatt's gun, which later in interviews, Rosenblatt would say he never felt Elijah reach for his gun. This is the point of the call where carotid pressure by Officer Rosenblatt is applied, and then shortly after, Woodyard applies it as well. Now, let's take a moment and talk about what carotid pressure is, because sadly this becomes a huge part of the case as well. Carotid pressure is essentially a chokehold. It's a type of forceful restraint that officers may use to gain temporary control of someone by knocking them unconscious. So you literally take your arm and you go around someone's neck, and it squeezes on the sides of the neck, occluding the carotids, occluding oxygen and blood flow to the brain, causing temporary unconsciousness. Officer Rosenblatt tried to apply it first, and he was unsuccessful. Elijah just kept fighting him. He wasn't getting the correct amount of pressure. So then Officer Woodyard immediately took over and applied carotid pressure to Elijah and was successful. Elijah did fall unconscious. This is a really interesting note in the court document that I do want to bring up, because I don't think a lot of people know about this. When a provider is subpoenaed to go to court, subpoenaed basically just means they're being called to talk about the call or talk about whatever happened during an event. And in this case, all of the providers got subpoenaed, right? And they had to recall and explain what happened during the call. When something like carotid pressure is applied, they pulled trainings of all three officers that ended up getting charged. And they said when they had trainings, they were very well trained, they were very well educated, they knew exactly what they were doing when they applied carotid pressure. So when a provider gets subpoenaed, that's something that will happen. For example, if I got called to court because a patient was trying to say that the way I started the IV was abusive, or the way that I started the IV was incorrect and it ended up causing them harm, what my training chief would do is he would pull the records of all the trainings we've done in the past over IVs. And in court, it would say something along the lines of Paramedic Odell received IV safety training in August of 2024. Something along the lines of that. And then it would state what the training covered, like proper use, proper cleaning of the site, and then actual, execution of the skill. That is pretty normal when a provider gets subpoenaed to court. And that's exactly what happened here. Aurora PD pulled all their records stating that these officers had training in carotid pressure. This is going to blow your mind. The day before the call, Rosenblatt had training on carotid pressure. So August 23rd, Woodyard and Redema received training 10 days prior to the call about carotid pressure. Woodyard at one point was actually an arrest control officer, which I'm assuming is kind of like a person in charge of these trainings and, teaches other officers about how to restrain responsibly, whenever there's a situation that restraints need to be applied. Rosenblatt was also one of these control officers. So not only are these officers very well versed and recently trained in this very serious maneuver to gain control and compliance of a subject, during these trainings, they were educated how dangerous it was when this maneuver is performed more than once. And this makes sense physiologically. You don't want to cut off and put pressure on the carotids more than you have to. It's very dangerous, and knocking someone unconscious like that is not very safe, especially when you're doing it back to back. After this, Rodema placed Elijah in an arm bar, which is basically where they take someone's hand and they twist it behind their back and pull it up to their shoulder blades. It's a very, very painful maneuver, and it actually can cause your arm to fracture if you pull it hard enough. Or, in this case, Rodema says he pulled Elijah's arm so hard he heard his shoulder pop 3 times, and then called for fire and EMS per protocol. Whenever carotid pressure is applied, they have to call for, EMS for patient evaluation. While waiting for fire and EMS, Elijah actually regains consciousness and starts to squirm in discomfort. He also, at this time, vomits multiple times. I want to remind you that Elijah was wearing a ski mask. So he has a mask that is covering most of his face, and probably during the scuffle, whether he's rolling around on the ground with the officers, that mask shifted at some point. So like a little bit of it was covering his mouth, because when they collected all of his clothes for evidence, there's actually vomit inside the mask. So while he's handcuffed, while he's being held on the ground in the recovery position, which the recovery position is basically when you just place someone on their side, whether it's the right or the left, he starts vomiting multiple times. At no point is anyone checking Elijah's status, whether it's pulse, respirations, or how well he's breathing. No point. This man has vomited multiple times. He is squirming in discomfort, and he is, at this point, actually altered, and no one is checking on him. Elijah is heard multiple times saying that he can't breathe, and he's being held on the ground. As he tries to shift himself to become more comfortable and, breathe a little better, all of the officers start freaking out and literally, basically dogpile on top of Elijah. Rodema places painful compliance, which it doesn't really specifically say what he did, whether it was another arm bar or something like that, and yelled to Elijah to chill out. During the restraint, Elijah continues to vomit and just say how uncomfortable it is, and he can't breathe. This is the time where Aurora Fire paramedics Jeremy Cooper and Peter Kachunik arrive on scene. So it is going to be important to note right here, because this was very confusing for me when I was reading court documents. There's Aurora Fire, and then there's going to be Falk Ambulance. So Aurora Fire is a fire EMS service where they are allowed to initiate patient care, but they're not allowed to transport. Falk Ambulance is a private service that will initiate transport. Paramedics were told by officers that carotid pressure had been applied. They did not say it was applied twice, but they did tell the paramedics that it had been applied. Later on in their interviews, Jeremy and Peter both would deny having knowledge of carotid pressure being applied, and you can literally hear it in the body cam footage that they were told carotid pressure was applied. So don't lie in your interviews is what I'm trying to say. Officers were also told by paramedics that Elijah was obviously on something and had incredible strength. And the paramedics just took up the officer's word. They took it straight to heart. They never performed an assessment. They never gained a set of vitals. They never even talked to Elijah. They never was like, hey man, what's going on? How are you feeling? Are you hurting anywhere? Nothing like that. They took the officer's word to heart, and they just automatically assumed, oh, he's suffering from excited delirium. Again, let me just say this for emphasis. Jeremy and Peter never touched Elijah. They never performed an assessment. They did not get a single set of vitals. They never even talked to Elijah. And they drew the conclusion based off of what the officers told them that he was suffering from excited delirium. Let that sink in. 500 milligrams of ketamine was ordered to be administered by Peter Kachunik, and Falk ambulance went to their ambulance. They got the vial. They drew up 500 of ketamine, and Peter administered it to Elijah while he is still being restrained on the ground by all the officers. They freed up his right deltoid, which is right here in your shoulder, and they administered 500 of ketamine. So they waited for a few minutes for the ketamine to kick in. They put Elijah on the stretcher, and at this point, you can obviously see in body cam footage that Elijah is unconscious with snoring respirations. Soft point restraints, which are just like soft handcuffs that go on your wrists and feet, and you can tie them to the cot. They're very commonly carried in ambulance services. They were applied to Elijah, and when he is secured in the ambulance, both paramedics quickly notice that Elijah is not breathing, and he does not have a pulse. Not much is really said after this other than CPR was initiated and Elijah was transported to University of Colorado Medical Center. But it's not really clear on details of the ACLS or the CPR that was performed. It does say that he was intubated and epinephrine was administered through his tibia. So I'm assuming they started an IO on him. But other than that, it does not say when his pulse was regained. Basically, in my head, the way it's read in the autopsy is he eventually regained a pulse. And this is after he had already been transported. So in my head, the ER staff actually continued the cardiac arrest and got a pulse back eventually in the ER. But he did not regain consciousness with this. Elijah was taken to the ICU where he had several other injuries and just ailments that happened. And on August 27th, 2019, 3 days after the incident, Elijah passed away. That is a piece of information that is a little different per source. In the actual autopsy results, it said that August 27th is when he passed away. In a couple other cases, it said that August 30th is when he died. I am not positive on that. I pulled that straight from the autopsy report, like I said, so take with that what you will. Either way, it is very shortly after the incident occurred. All right, let's take a little bit of a brain break because that was a lot. The body cam footage is around 20-25 minutes long, and it is just one thing after another. When I sat down and watched it, I came into this case with a preconceived notion that it was a paramedic fault. Watching the body cam footage and realizing it is an everyone fault was something really hard to swallow. Let's get into the autopsy before we start talking about the charges because the autopsy is actually pretty interesting. So I don't have the exact date on here, but the autopsy was originally released with an undetermined cause of death. And this is after the preliminary reports were released by PD and fire and saying basically all responders followed per protocol when it came to the forceful restraint, the ketamine administration, all the above. It was not till much later that the autopsy was re-released and stated that the cause of death was complications of ketamine administration following forceful restraint. Autopsy was performed on September 3rd, 2019 by Adams County Coroner's Office. Externally, Elijah only had some abrasions noted to the face, some on the body, not a whole lot externally. Now, internally, the main thing that was seen on the autopsy was the lungs had evidence of aspiration pneumonia. So I mentioned that Elijah had vomited multiple times and that he still had a ski mask on his face. What is thought to have happened is Elijah aspirated. And this basically means he vomited and then he actually breathed back in that vomit and it went into his lungs. And obviously when something goes into your lungs, that's not air, it's not supposed to be there, it can cause infection. And aspiration pneumonia is something that is pretty deadly. It's not a good thing whatsoever. Reading through the autopsy result is kind of like contradictory in some parts. Basically, Elijah's body had been through a lot, mentally and physically. He had been going through fight or flight, basically. His body had dumped a bunch of adrenaline, which is that hormone that is released when your body is trying to basically compensate for all of the fear and adrenaline going through your brain, just like a I need to protect myself type of feeling. So he had an adrenaline dump in his body. And Elijah's autopsy revealed that he had severe metabolic acidosis. The basic explanation of metabolic acidosis is there's a chemical imbalance in your body. So your body needs a really healthy balance of like oxygen and CO2 and your electrolytes and the hormones that all regulate your body's normal functions. Your body needs oxygenated, your body needs the electrolytes to survive, and everything needs to be flowing through the body equally to perfuse all the organs and let everything happen in perfect harmony. Metabolic acidosis specifically is when the blood in your body has too much acid or CO2 and it's not able to get rid of it all. In your body, we describe this balance as acid-base. So in paramedic school, when you learn about acid-base and the equations of it, you're going to learn about respiratory alkalosis and acidosis and metabolic alkalosis and acidosis. Both acidoses basically mean there's too much acid in your body. There's not enough base to balance it all out. And when there's not enough base, you're not allowed to get rid of this acid in your body. And there's a couple different types of acidosis. Most commonly, a lot of people know DKA or diabetic ketoacidosis. This is a pretty common type of acidosis. There's also lactic acidosis, which is what Elijah was thought to have had. Lactic acidosis, the definition of it is the cells in your body will make lactic acid, and when they don't have a lot of oxygen to use, the acid can build up. It usually happens when you're exercising immensely. And the struggle that Elijah went through could be seen as a pretty hardcore workout. This can lead in big drops of blood pressure, heart failure, and cardiac arrest, and overwhelming infection to go along with it. When your body has been through so much, we kind of explain it in healthcare as a body will start going across the cliff and then rolling down it. And how fast you roll down it is based off of how critical you are. And Elijah's body kind of rolled down that hill very, very fast. He went from fighting for his life to now his life is gone. So on top of the metabolic acidosis and his body trying to compensate and fight, he was given ketamine. Ketamine is ultimately what caused his body to just have that final white flag and shut down. Let's give a brief summary about what ketamine is, all right? Ketamine is a dissociative hypnotic, a sedative, a mild pain reliever, and it does have bronchodilatory effects. In your nervous system, you have neurons, and those neurons release chemicals when they are stimulated. Glutamate is one of those chemicals. It is known as the excitability chemical. It's because when this is released, it is when the neurons are the most stimulated. Glutamate has receptors, and one of those receptors is NMDA. That is what ketamine blocks. And because those receptors are blocked, the glutamate goes towards the other ones, which is how ketamine creates that kind of out-of-body hypnotic effect and sedates someone. It also competes with opioid receptors, and that is why it's known as a mild pain reliever. Ketamine has an onset of about 10 to 30 seconds IV, intravenous, and about 3 to 5 minutes IM, intramuscular, which is how Elijah got the drug. The duration of action can be anywhere from 5 to 30 minutes. It really just depends on how the person metabolizes the medication. I have seen people stay sedated for upwards of 45 minutes, but then I've seen ketamine wear off in 10 minutes. It really just depends on what's going on in the body. Does the patient have other drugs on board? Do they have alcohol on board? Or does their body just metabolize things really, really fast? Some of the adverse side effects of ketamine, obviously that confusion, that delirium state, tachycardia, blood pressure changes. I don't want to say hypo or hypertension, low blood pressure or high blood pressure, because it's actually been known to cause both. Ketamine is usually favored because it's very blood pressure safe, whereas the other sedatives that EMS and healthcare gives sometimes is not blood pressure safe. Respiratory depression, apnea, laryngospasms, which is where you have spasms in your vocal cords, or hypersalivation. Depending on the dose, it is preferred for some pain relieving effects. It's actually very popular when we are trying to do conscious sedation for maybe resetting bones or doing very painful procedures. So let's talk about the elephant in the room. Elijah was given 500 of ketamine. Now, if you've never seen a ketamine vial, that's the whole vial. It usually comes in 10 mLs, 500 milligrams. So that means they drew up all 10 mLs and gave him the entire syringe. This sounds like a lot. Let me explain something really quick. There is an IV dose and there is an IM dose. IV doses are noted to be anywhere from 0.5 to 1 milligram per kilogram. And IM doses is really kind of service dependent. It can be anywhere from 4 to 5 milligrams per kilogram. I know this sounds like a lot, but an IM dose is supposed to be more than the IV dose. When you're giving something IV, it's going straight into the bloodstream. Your onset of action is going to be much quicker. Like I said, it's anywhere from 10 to 30 seconds. But when you're going through a muscle, like a deltoid or your thigh muscle or the gluteus muscle, there's a lot to go through. It's not going straight into the bloodstream, depending on how thick that muscle is. So because ketamine usually has a quick onset, you're actually losing some of it when you go through the muscle, and that's why it's so much bigger. The paramedics estimated Elijah to be around 200 pounds, which would be 90.7 kilograms, and that protocol for ketamine for them was 5 milligrams per kilogram. Like I said, I know that sounds like a lot. My personal protocol at my service is 4 milligrams per kilogram. This should mean that he should have been given 453 milligrams of ketamine. So no matter what, they overdosed him a little bit, even at the weight they were stating he was. Spoiler alert, Elijah was not 200 pounds. He was 143 or 65 kilograms. At this weight, he should have been given 320 milligrams of ketamine if we're following that 5 milligrams per kilogram protocol. Because of the pathology and how ketamine works, especially in those high doses, because he was suffering from metabolic acidosis, his body was already in fight or flight. There is lactic acid buildup. He's aspirated. His body has a adrenaline dump going on. Now you add in ketamine, which depresses everything. It's causing that sedation. It caused his body to shut down faster. It basically just accelerated that fight or flight until Elijah's body hit the wall. Like, instead of rolling down the hill, we just jumped straight off the cliff. That is why the cause of death is listed as ketamine complication with forceful restraint. The forceful restraint is what caused him to be in the fight or flight mode and the lactic acidosis and then eventually the aspiration pneumonia. But when you gave that ketamine, it caused his body to just completely shut down. The most powerful statement in this whole case, said by the medical examiner, is, "I believe that Mr. McClain would be most likely alive, but for the administration of ketamine." When I first heard about this case, the way I heard about it was through the media and social media outlets, news outlets, and it was because the ketamine craze was being portrayed. And it's very comparable to the opioid crisis and the opioid epidemic and how everyone is in this paranoia that there's fentanyl on these dollar bills in grocery stores, and if you touch it, you're going to overdose. Like, don't touch anything because that white powder is going to cause you to stop breathing. That same frenzy and crisis that the news outlets and social media outlets create, that's exactly how they were portraying ketamine too. All of these news outlets and articles that you read online was portraying ketamine as this deadly and dangerous drug that EMS providers have access to. Now, I'll be honest with you, I fell victim to it. When I discovered this case, 2021, brand new paramedic, I had just had my own experience with administering ketamine. And that whole call was a very traumatic experience for me. And it will be a call that I talk about here on the podcast pretty soon. I've actually talked to Mike, the world's okayest medic. He's going to come on and talk to the call with me. And because of that traumatic experience I had where ketamine was involved, I fell victim to this frenzy that the news outlets were creating. It was not until I did my own research, simple 3 Google searches that anyone can do, opened my books, and discovered, actually, you give ketamine properly, it's not deadly. The causes of death related to ketamine are quite minimal. Ketamine has more positive effects than negative effects. But because news outlets and media platforms were just blasting, this man died after he was given ketamine, and then Aurora, EMS, FD, all the above, were taking ketamine off their trucks. And I do believe, I've talked to a couple people that are close with Colorado, I'm pretty sure it's still off of their trucks. They were playing into what media is creating. That's insane. But I can't say a lot because I fell victim to it as well. That just infuriated me the more I looked at it. Now, being 2 years later, I have obviously 3 years later. 3 years later, that's insane to me. Being like a quote unquote seasoned provider, I know much more about ketamine, and I've administered it several more times since 2021. Like I said at the beginning of the video, bad paramedics kill patients, not ketamine. Let's get into those paramedics, okay? So, the charges. I'm not going to go through, if I were to go through all of what happened in the court documents and each individual court case, because there were 3 of them, the paramedics were charged together. No. Yeah, were there 3 or 4? There might have been 4. I do know 2 of the police officers were charged together. One of them was charged separately. And then I think both paramedics were charged individually. Like they had their own individual trials. The trials were dramatically separated out. I'm going to link, the city of Aurora has a whole timeline of the events pertaining to Elijah's case. It's astounding how long it took. Literally 3 weeks ago, actually probably more than a month ago now, just shy of 3 weeks ago, there was a change in the case. So this happened in 2019. It's 2024, and there's still changes happening within the case. It's such a long, dramatic, drawn-out thing. But it all started initially after the incident. Preliminary reports were released by police and fire stating that all responders followed protocol and all actions were justified within their scopes of practice. Basically, this is the departments covering their butt saying, our responders did everything that they were supposed to per our protocols. It was not until February 2020 when several changes in office on the PD and the city side. So PD had a lot of chain of command changes with their sergeants and lieutenants and all of that. And then the city also elected different people to be in office. Elijah's case was looked at with new eyes. So this happened August 2019. It is now February 2020. When the departments thought they could just brush it under the rug, they thought they were fine, they thought they were in the clear. February 2020, there was enough hell raised, new people are in office, and now Elijah's case is getting a fresh set of eyes looking into it. In June 2020, General Attorney Phil Weiser would be appointed to take over this case, and he is the man that eventually indicted with 32 counts 3 officers, and 2 paramedics. Some of these charges included assault in the second degree, criminally negligent homicide, manslaughter, and crime of violence. Let's just say, Phil Weiser, you are an angel. You are a saint. You are the man. So let's start with Nathan Woodyard because he was the first person on scene, the first person to ever make contact with Elijah in the first place. He was acquitted of all charges. And now acquitted basically means they're free of all charges. They are not guilty in the court of law's eyes, which is insane to me. But he was acquitted of all charges. And he was also, this is the most insane part, he is the only officer that was reinstated by the Aurora Police Department, initially on restricted duty, which basically means they're not allowed to have any contact with the general public. They're basically just doing like office work within the department. That was wild to me. He is the only officer, like I said, that was reinstated by the department, but free of all charges. This is a free man walking around and now reinstated by his department, even after he's the one who instigated it all in the first place. He was the first person on scene, the first person to make contact with Elijah. That's insane. Randy Redeema was found guilty of negligent homicide and third-degree assault. Jason Rosenblatt, which was the, I believe, second officer on scene, he was acquitted of all charges as well, so he is walking free. But I do not believe he works for the department anymore. I think he was let go. And Randy Redeema was found guilty of negligent homicide and third-degree assault. He was originally sentenced to 14 months in jail and then 4 years of probation. So let's talk about the paramedics now. And something I did not mention earlier was in the court documents, it makes a note saying the emergency physician of the University of Colorado Medical Center raised suspicion that he did not agree with the excited delirium diagnosis and did not agree with the paramedics' administration of ketamine. So basically, that is kind of what kickstarted a little bit of the investigation. He's like, hey, what happened on scene? Let me read them reports. So he pulled the paramedics' reports, read them, and was like, yeah, no, I don't agree with this whatsoever. So keep that in mind. Just slip it in there, okay? Jeremy Cooper and Peter Kachunik were found guilty of criminally negligent homicide, but not guilty of reckless manslaughter or second-degree assault with no intent of causing bodily harm. So criminally negligent homicide, perfect, cool, but not manslaughter and not second-degree assault. Peter was also found guilty. Now remember, Peter is the man who ordered the ketamine in the first place and administered it. Peter was found guilty of second-degree assault by unlawful administration of drugs. So basically saying that by administering ketamine, it was seen as assault towards Elijah. He was also sentenced to 5 years in prison and 3 years probation following his sentence. This is the recent update. Just shy of 3 weeks ago, Peter's sentence was vacated, meaning he was released from prison. His sentence was changed to 4 years probation. So he is out of jail as of today, posting this episode. He is just on probation now. So let's wrap this up. I have 2 final thoughts. The first one I want to make is towards the police officers. Like I said, when I first started researching this case, I did not know that police was involved. I thought this was strictly a negligent paramedic case. And watching the body cam footage shocked me. Now, I want to make something very, very clear. I do not have hate towards police officers. My boyfriend is a police officer. My best friend is a police officer. I have amazing experiences with the police officers in my county, in my area. I have thanked police officers on several occasions during my calls. I think they're amazing men and women. But just like I mentioned on my TikTok not too long ago, you're going to have bad apples in the bunch. You cannot have a bunch without having at least one bad apple. The problem here is a lot of people resonate that one bad apple with the whole bunch. So now they think that the entire batch is contaminated and every single person's a bad apple. I do not want to make this video to be a hate video, but I will say that the way they approached Elijah was they didn't even approach him like a human. And I firmly believe that everyone should be treated the same, whether it's race, gender, sexuality, religion, all the above. So I don't think that was the only role that was played, though. These officers truly did not approach Elijah like a normal human being. They approached him with such aggression. And when I talked to my boyfriend about it, like I said, he's fresh out of the academy. He has the freshest knowledge of this is how you approach somebody. You obviously approach somebody with caution. There was a lot of court documents and articles saying that, well, the officers were nervous that he was armed. Okay, that's an understandable cause. That's an understandable fear. But why would you approach someone that you think may be armed with such aggression? Because if they were armed, they're going to act quickly. They're going to act to protect themselves. I don't think the way they approached Elijah helped in any way, shape, or form. And I truly believe if the officer would have approached Elijah like a normal human being, hi, my name is Officer Woodyard. How are you doing today? Are you doing okay? We got a call for a suspicious person. I just want to come check in on you. Are you doing good? If he would have just approached him calm and collected, I don't think this case would be a thing. I think this case wouldn't have even happened. But instead, he approached him with such aggression and such just vile and volatile, hostile. He approached him with such hostility that it never de-escalated. It just kept escalating. And that escalation is what ultimately caused Elijah's body to go into extreme fight or flight mode and then got escalated by the negligent paramedics. I don't even have the words to describe the just anger I have with these paramedics. Not just as like paramedics, EMS providers, healthcare providers. The first thing you are taught at the basic level, EMT level, even any healthcare provider, the basic level, the foundation of interacting with a patient is your assessment. Your assessment starts in two ways, subjective and objective. You ask the patient what's going on, and they're talking to you, and they're telling you all these details, and you are gathering information about why you are even there. And then you do your full body assessment. You are looking, listening, and feeling their entire body to see what's going on. Your patient assessment is the basic level of care that we can give to a patient. Not only is talking to our patient part of an assessment, a full body assessment, head to toe, looking at our patient, vital signs is also that basic patient assessment. And these paramedics did none of that. They didn't even talk to Elijah. They didn't even ask the dude his name. They didn't introduce themselves as well. They took everything that these officers said straight to heart. Straight word. They put their hand on the Bible. They thought this was the truth. They did not do their own assessment. They did not do a single thing to form their own opinion about what was going on with Elijah. I don't think this is a one or the other's fault. I think this is both parties, PD and EMS, equally their fault. Because if PD would have started the interaction in a much different way, EMS may never have had been called. They could have been like, hey, Elijah, you good? Perfect. Be safe on your way home. And everyone went about their day. But instead, we started off with such hostility and aggression that it escalated and kept going further down the hill. It makes me disappointed as a healthcare provider that this man died when he should not have had to. And it makes me disappointed to be a first responder because interactions like this with PD and EMS makes people scared of calling 911 and of having these people arrive on scene. I just made a few TikToks about this not too long ago. When people have negative interactions with first responders, whether it's PD, fire, or EMS, it makes them scared to call 911 again. And it sucks. It's like this bias they build against first response. And it's understandable. 90% of the time, biases form from negative past experiences. But the thing about biases is they're really, really, really hard to break and build on because people are so stubborn from that negative experience that they can't see the new information in front of them. I think that a lot of people, especially in this area, Aurora, Colorado, or just Colorado in general, they're going to now have those negative biases because of these police officers, especially because one of them is back in their department, which is still mind-blowing to me. The more paramedics, police officers, and fire departments listen to this case and listen to how the responders acted versus the outcome, it will make us better providers. Talk to your patients, do an assessment, because that is literally the most basic thing we can do for them. And just talk to people like they're humans. No one deserves to be talked to like they're an object. They all deserve your one-on-one attention. And like I've said several times on my TikTok, and I say this to students all the time, we are there to get people safely from point A to point B, and we are there to deliver the best patient care that we possibly can. We will not be able to deliver that patient care if you walk in with a negative bias. Give everyone an open perspective. I know that this episode was a very, very long one. I have 3 clips that are at least 40, 30, and 20 minutes long that I'm going to have to edit and kind of condense down. But this is a case that I wanted to discuss. It is one that I think every single police officer and EMS provider and fire provider needs to hear about. This is a case that can make us better providers for those future patients out there in Elijah's honor, because nothing can sadly bring him back. But the work we do now for the future patients can be done in his honor. Like I said at the beginning of this video, if you like this type of content, please tell me and give me suggestions of other cases. I will gladly deep dive into them, or if I can't find a lot of research, I would love to reach out to some of you for information on them, because this type of format is something that I truly enjoyed. Deep diving into a case, finding out all that I can, and being able to take something away from each case that will make me a better person and provider, and then share it with you guys so you guys can work on yourselves as providers as well. There is something that we can do every single day to make ourselves better providers for our future patients. That is all. Please subscribe to my channel. Please hit the bell icon so you're notified every single time I post. Go find me on other social medias. They're all going to be linked down below. And thank you for listening. Have a good shift.